Hello everyone, welcome to today's lecture. In this video, you will learn Alprazolam case studies, 10 case studies. You will learn patient backgrounds and clinical presentations. You will learn clinical assessment findings. You will learn also rationale for choosing Alprazolam, treatment decision making, dose decisions, key safety considerations when you are prescribing Alprazolam, monitoring balance, and treatment outcome. So, your first clinical case study is a 34 years old adult who presents with sudden onset of panic attack, chest tightening, fear of control of losing, assessment refills, elevated heart rate, hyperventilation, insomnia due to anticipatory anxiety, and you choose Alprazolam for rapid anxiety effectiveness, and you started the patient at 0.25 milligram 3 times a day. Safety considerations that you are looking for or monitoring are sedation, dependency, withdrawal, and dizziness. You will monitor vital signs, sedation level, and misuse risk. The outcome that you are looking for are acute panic attack reduction and long-term plan to transition the patient into SSRIs. I hope you enjoyed the first clinical study and stay tuned for the second case study. Your second clinical case study is a 41 years old adult with generalized anxiety who reports constant worries, irritability, and muscle tightening. The patient already had a hydralazine and it failed to control the anxiety. And then you choose Alprazolam because of the short acting, while you want to transition the patient to sertraline. And the dose that you choose to prescribe is 0.25 milligram 2 times a day. And the safety consideration are cognitive slowing and sedation level. What do you want to monitor? You want to monitor daily functioning and fall risk. You want to monitor if the anxiety or the sedation or the cognitive slowing affect the patient daily functioning. You monitor anxiety stabilization and Alprazolam titrate into 4 weeks. So you will titrate the Alprazolam in 4 weeks. So that is the second case study. We are going to do the third case study. Your third clinical case study is a 29 years old adult with PTSD experience with flashbacks and nightmares and hyperventilation. You choose Alprazolam briefly for sleep onset, and the dose you choose is 0.25 milligram before bed. Safety consideration is respiratory risk with alcohol and dependency potential. So you teach the patient, don't take this medication with alcohol, and you will monitor the potential dependency. You will also monitor sleep pattern, avoidance of central nervous system depressants, medications, and the outcome you are looking for is improved sleep. You will discontinue within 2 weeks as drama therapy begins. That is your case study, what to look for, what to monitor, how you want to plan for the treatment. Your fourth clinical case study is a 50-year-old adult undergoing job stress and reports acute situation anxiety. No psychiatric history. So this patient don't have any psychiatric history, but they have a difficulty job and they have stress and it's situational anxiety. You prescribe Alprazolam at 0.25 milligram as needed for presentations when the patient want to perform or when they want it going through stressful situation, they can have as needed Alprazolam of 0.25 milligram. The safety monitoring or safety is avoid daily use. So this is just as needed, not everyday use. And caution when you are driving. Don't take the medication when you are driving because it has a sedation and it can slow the judgment. What do you monitor? You monitor usage frequency because you will see how many days they take, how often they will run out the medication if they take every day or every often, and you will monitor impair judgment, impair daily life functioning, impair anxiety control. You will monitor that, and the outcome you are looking for is control situational anxiety without escalation. That is the outcome you wanted reach and you wanted the patient to have, that you wanted them to control their anxiety without escalation of more anxiety, of more dependency, or more worsening the situation. Your clinical case study is a 65-year-old adult with chronic anxiety and poor sleep. You choose Alprazolam lower dose because this is adult. I mean, this is the senior almost. And then you choose the dose 0.125 milligram at bedtime. And the reason you choose is the age-related sensitivity. Patients who are older, they are sensitive to Alprazolam. It increases their fall risk, it lowers their cognition, and it creates paradoxical agitation. So you monitor fall risk, cognitive effectiveness, and paradoxical agitation. What you also monitor their gait if they are walking normally, and you also monitor sedation level and confusion. People who are older, they get confused when they take Alprazolam. That leads to fall risk. The outcome you are looking for is mild improvement for the anxiety, and then you transition the patient into bus bar to improve their chronic anxiety and poor sleep. Your next clinical case study is a 30-year-old adult with depressive symptoms and anxiety, and they receive alprazolam 0.25 milligram 3 times a day, while starting with one venlafaxine. The safety consideration is worsening depression, suicidal ideation, and sedation. That's what you monitor for or look for to consider safety consideration. And then you monitor their mood, their agitation, and sedation level. The outcome that you are looking for through the patient is reduced anxiety, and then you titrate alprazolam in a 6-week. Your next clinical case study is a 47 years old adult with alcohol withdrawal. They have tremors, and you prescribe them alprazolam short-term in supervisory detox facility. So this is the control facility where you monitor, and there is always provider and nurses, respiratory present. So it's the detox facility. So the patient is in a detox facility to monitor the situation. And then you prescribe the patient alprazolam, and the dosage is 0.25 milligram 4 times a day. The safety consideration is the respiratory depression, because alprazolam causes respiratory depression, and cross tolerance, if there are tolerance to the alprazolam, and overdose risk, because alprazolam has overdose risk. What do you going to monitor? You will monitor minus protocol. You will use the minus protocol to assess the alcohol withdrawal, and then you use Kiswa, Siwa or Kiswa, and the viral sinus. The outcome you are looking for is withdrawal stabilization. So patient is stable, they are coming down with the withdrawal symptoms, are getting less and less, and then you transition the patient into long-term acting of benzo protocol. So your 8th clinical case study is a 38 years old who want to travel to abroad and develop severe flight anxiety. You prescribe then alprazolam 0.25 milligram as needed. Just as needed, not all the time, not every day, not once a while, as needed. So only when you are having that panic attack of flying to different place. What is the safety consideration? The safety consideration is a sedation level and impairment coordination. You monitor a travel schedule and the single dose use only when you are traveling. What is the outcome you are looking for? The outcome the patient is looking for is flight tolerance without panic symptoms. That is the reason you are prescribing alprazolam for the patient. Your 9th clinical case study is a 26 years old adult with performance anxiety before the exam. You prescribe alprazolam 0.25 milligram as needed selectively before the exam. You will take that before the exam only. And the safety consideration is cognitive impairment, interference with the study because your judgment is lower and your sedation is higher. You monitor impair on alertness because that's what it costs. If you want to study and you want to take Alprazolam, it can affect your alertness. So you have to weigh the risky with the benefit. The outcome that the patient is looking for and you want to monitor are reduced physiological anxiety without functional impair. You want the patient to have reduced anxiety without interfering the function daily life function, or they want to study exam. So they should be able to study the exam. If they couldn't, you have to discontinue the medication. Your 10 clinical case study is a 58 years old adult who is recovering from surgery and experiencing anxiety and insomnia. You prescribed the Alprazolam 0.25 before bed to use briefly. So this medication you wanted them to use briefly to control the insomnia and the anxiety so they can recover better. And the safety consideration is respiratory depression with opioids. You want to monitor the timing with the pain medication and sedation level because pain medication can increase when you take pain medication with Alprazolam, that can lead to coma and that can lead to death because it increases the sedation level. The outcome you are looking for is the improved sleep, and then you want to discontinue Alprazolam before you discharge the patient. I hope you like this case study, and please subscribe the channel and come back more. I'm going to do more case study for different medication. This is the way you can remember the medication. This is the way you can use it effectively, and it include patient education. A lot of skills you can gain from this lecture. So please subscribe and watch my next videos that I am going over other medications similar way. Thank you for joining me today.